I do notice that, if you are someone who is an adrenaline junkie, you really enjoy that ER work. We're not that. We are not, isn't we're not like, we do get catastrophic files, but we're not doing hands-on care. That's really important. If you've worked in a home health role or you've been in some sort of capacity that's put you out on the road, it's similar in that way that we have to be, independent. Number one, no one's working there watching you work, making sure you're getting things done. So independent. And also you don't have that collaboration with your team every day. So you're not working in an office with other people every day. You do see your injured worker, but that's really it. So your teammates, while you do have a team, you don't ever really see them. You might see them once a quarter or maybe a few times a year. So you need to be able to really work independently and be okay with not, with leaving the patient care part behind. Yeah.
It sounds like you might still have a nice bond with some of the patients, though, that you're working on with this case. If you're going to doctor's appointments and maybe you're on it for a longer point. So leaving patient care behind, but maybe not leaving the connection of being with the patient. Do I have that assumption right?
So it's really important that we are, so there's two things, and I wanted to say this earlier, is that
Mhm.
we are expected, and it's important that we stay up to date on all the current medical trends, right? So if there's some new, just for instance, one of the doctors here in Tennessee, he's just started doing ultrasound guided carpal tunnel releases. That's new and it's very innovative, and that can be a huge savings for the insurance carriers if that sort of thing is approved. So we want to stay up to date on that. We want to know, is that appropriate? Is that something we would suggest as a nurse, even though we're not in the midst of it. We're not at the bedside. We want to stay up to date on the current trends. But then also, like you say, even though we're not providing that hands-on care, it's important that we, maintain empathy, maintain compassion, but then also stay professional because we are working. Our referrals come from the insurance company, from the employer, and from, so essentially, yes, from those parties. So we have to be an unbiased party, right? So we
Mhm.
always want to act with kindness. We always want to act with empathy, but then also just, you know, like I say, maintain a caring and compassionate stance toward anyone that we come into contact with. Even if it's someone such as the physician's office, of anyone that we come into contact with.